Thank you everyone again for joining us today. My name is Cheung. I am the head of product at Inguo.io. The name Inguo is a combination of Japanese and Chinese, which means cause and effect. We provide a cloud-based automated platform for data analysts that perform causal modeling and visualization. Our automated causal discovery software eliminates human bias, reduces time-consuming work, avoids human errors, and lets you focus on the whys in your dataset. Talking about correlation and causation, there are just different ways to assess relationships between variables. So let's start by looking at the number of possible relationships between variables. Traditional mathematics look at two variables and tries to determine a single relationship. However, in the late 70s, Julia Pearl, a UCLA computer science professor, described three potential combinations for the relationships between two variables. A can cause B, B can cause A, and the third relation is no causation at all. So the number of potential models is 3. Current analysis tools like correlation and regression rely on just a single relation, while the root cause remains elusive. And why is that the case? Now, think about causal relations for more than 5 variables becomes impossible due to the combinatorial explosion, as we can see here. When there are 9 variables, there are 150,000 trillion combinations of relations. This is an impossible task for the human brain to process. So this is where machine learning methods come in to assist human experts. The current decision-making approaches are based on descriptive, modeled, and associative results. This means, for example, diseases are identified based on how correlated they are with patients' medical history and symptoms. There was a recent research paper published on Nature about a month ago on this exact topic. It rightly pointed out that a correlation, or it's called associative approach, is in fact in contrast to how doctors perform diagnosis, which is fundamentally a counterfactual inference task. So doctors select disease which offer the best causal explanations for the symptoms, and then rule out the correlated ones that has no causal effects. This particular research found that the counterfactual algorithm provided a better diagnosis for 29% of rare and 33% of very rare diseases compared to the associative algorithm. Okay. So here is a virtual comparison between correlation and causation using the example of the diagnosis of lung cancer. We'll cover this in our demo shortly, but just a quick glance at the two graphs shows clearly how many correlations are eliminated to the actual cause and effect of lung cancer. This particular causal discovery was completed on our platform within 5 minutes. Traditionally, this is biased and a very labor-intensive process due to the combinatorial explosion and interpretation of the results. We run the raw dataset. We run the raw dataset through our machine learning model and produced this counterfactual output to assist human experts with unbiased decisions. Okay. Now, there are many use cases in both healthcare and pharmaceutical that can benefit tremendously from causal discovery. And here we're listing some common examples, and later on, we'll demonstrate a couple of examples on our platform. The first one we are going to show everybody is customer satisfaction, but in healthcare services. We used a partial data set from Medicare.gov Hospital Compare website. The goal here is to study the top key drivers to hospital overall rating. So what are the top key drivers that drives the hospital's overall rating? The machine learning data model identified the causal structure and calculated the total causal effects from each variable to the target. The data here, as we can see, tells us safety of care, readmission, and patient experience are the top 3 drivers to a high hospital overall rating. But does that mean in order to drive up my hospital overall rating, I should focus on all 3 of them? If we think about it, it's unethical and impossible to increase the readmission rate. So here we use simulation on the right-hand side to increase the scores of safety of care and patient experience to see how much it affects the overall rating. The next use case is about health insurance and policy making. We don't have an example here, but I'll use so there was a BMI research paper published in December 2019 to study why social disparities in healthcare persist in the US, despite the expansion of Medicaid. Based on the study, the causal impact shows that income is a major factor in a patient's health and quality of care received, even with equitable access to care under a universal health insurance system. Policies focusing on addressing income, therefore, is very important in improving health outcomes for patients in lower socioeconomic status. Let's go through the next set of examples. This set of use cases are in diagnosis and treatment. The first use case we'd like to cover is preventive care. This is to answer the questions of what are the likely causes of an illness. In the preventive care of lung cancer, from observed patient data, we can identify that the impact of all the direct and indirect causes of lung cancer, including smoking and air pollution. Although some of the lung cancer can still occur through other causes that are not in the observed data, but certain prevention can still be accomplished by the elimination of smoking and exposure to asbestos. The next use case is in condition monitoring. How can we detect an illness so that the patient can be treated as early as possible? By running a causal model on data that contains lung cancer patient symptoms, we can discover fatigue, dyspnea, and cough as some of the major symptoms for practitioners to consider. The last one on this slide is about effective treatment. If we have patient diagnosis and treatment data, we can identify the list of most effective treatments for an illness. In addition, we can identify, we can perform simulations to predict the potential treatment outcome. Moreover, we can find the root cause of patient turnover, emergency room efficiencies, and all other aspects that can drive up costs, creating greater economic pressure on the providers and having a negative effect on the treatment outcome focused on the patient. So those are just some of the many use cases that can benefit from causal analysis. So now I'm going to show you some examples on our platform. share my screen. Okay. So now I'm logged into our platform. Go to my project. The first use case I'd like to show everyone is health insurance. The goal of this health insurance file is to help people understand what drives higher medical insurance premium charges. And as we can see, there are 7 variables and 1,339 samples. And this file contains mixed data types. For example, age is numerical, sex is binary, region is a categorical value. We'll start the analysis by uploading the file as it is. We'll select the file, give a name. The file is already uploaded in our system. Here is a preview of the data in the file. Click on next. User have the flexibility to rename the nodes that will appear in the causal graph. Here we'll go as default. This step is a preview and to confirm how we are going to convert each data type. For example, numerical will remain as numerical. Binary, we can see the settings. Female will be converted to 1. Male will be converted to 0. And region here is a categorical value. It will be automatically converted to individual binary values. So if we click on next and complete the data uploading process, here we can see all of the variables are listed here. Originally, there were 7 variables, but now region has been converted into 4 different binary variables. And if we notice, this is a preview of the data set, and there's a missing rate column. There are no missing values in this particular data set, but even if there are, it's okay. We can handle missing value. So you have a choice to either ignore the columns, or you can fill the missing value by the average number, or there's some other methods. In this case, we are ready to run a causal discovery. We have different models, but based on the type of data set and what are the data present in the file, we show the list that's applicable to this particular data set. Here, we recommend hybrid model because this data contains a mixture of data types. So we'll use the default. Now, causal discovery is completed. But before we dive into it, let's take a look at correlation. Remember, the goal of this study is to see what drives insurance premium charges. So from this, if we highlight the premium charges, we see all of the variables are correlated to premium charges. We can tell smoker has thicker line. So it means smokers have a stronger correlation than the rest of the variables. But still, we can't really tell what actually drives premium charges. Now, if we go to causation graph, immediately we see sex and number of children has no causation to our target, which is premium charges. I'm going to set the color so we can see it clearly. This is our target here. But we can see immediately smoker has a very strong line into premium charges. So there are 3 variables that has direct causal effect to premium charges. That's age, BMI, and smoker. So blue lines means positive causal effect. Red lines are negative causal effects. In this case, if somebody is from Northwest region, then the BMI value tends to be lower. Remember, we uploaded a data set, so our model tells the truth from what data tell us. So this is unbiased. Later on, I will show an example that requires expert knowledge. But in this case, we can see there are 3 direct causes, but what are the actual key drivers? So this means what drives insurance premium charges based on the total causal effect to premium charge. So in this case, we see the bar chart on the left. Smoker has the highest total causal effect to premium charges. If somebody is a smoker, the charge will be very high. The second one is age. The third one is BMI. Interestingly, we can see if somebody is from Southwest, it has a negative causal effect to premium charge, means somebody from Southwest, the premium charge tends to be lower. The next feature I'd like to show everyone is imagine if I am a consumer and I'd like to reduce my insurance premium charges. How do I do that? So if I select premium charges under simulation, and I have a few ways to manipulate premium charges. So we know there are 3 key drivers that affects premium charge. It's age, BMI, and smoker. I'm not a smoker, so I can't adjust smoking, and it's unethical. It's unethical for me to smoke anyway. And I can't change my age to be younger even if I wanted to. So the only thing I can adjust here is BMI. Let's say if I reduce my BMI to 30, and then I simulate. I just refresh my screen. Okay, let's start again. I'll select premium charges simulation. If I change my BMI down to 30 and simulate, we see immediately my premium charges reduced by almost 1,000. This is very interesting. So this is a use case where a client can actually utilize simulation to adjust any of those variables to see potentially what might happen to my target. So the next data set I'd like to show is toddler autism. So this is another data set. So this data set was developed by Dr. Fadi Fayez using an app called ASD tests. And the goal is to study toddlers' behavior. And based on toddlers' behavior, if toddlers has a indication to a particular behavior, then the Q-Check-10 score goes up. And when the Q-Check-10 score reaches certain value, it means it's likely the toddler will have ASD traits. If we look at the first few columns, those are behavioral variables. And Q-Check-10 score is right here. So we are going to upload the data set as is. Okay. Now it's uploaded. We use all the default settings here, but when we are converting the data types, if you notice family member with ASD, the values are reversed. So here I'm going to change it so that our interpretation for every single variable is consistent. The next one is ASD trait. I'm going to flip this as well. Set no to 0, yes to 1. And this is only for consistency. When we are looking at a graph, we can interpret it easily. And now let's finish the uploading process. This data set is very similar to the previous insurance data set. So it contains mixed data types. That's why we recommended hybrid model. Well, that is running. Now let's see how many variables there are. There are 15 variables. So there are 12 variables and 1,055 samples. The reason this one runs a little bit longer than the previous one is because there are more variables. The way we build a causal graph is by taking 2 variables and then add a third one. Gradually, we build the whole causal structure. So the more variables there are, the slower it is. But it's not that much slower. As we can see, it's finished. If we look at the correlation graph, now Q-chat 10 score is our target. All of the variables are correlated to the target, and the strength, which is the thickness of each line, is about the same. We can't really tell what's causing, what are the top key drivers to a higher Q-chat 10 score. But if we look at causation graph, immediately we see there are a few variables that has no causal effect. So here, if we highlight Q-chat 10 score, we know all of the toddlers' behavior are used to derive the Q-chat 10 score. So if we look at this particular arrow, it's reversed. So we are going to reverse the arrow manually, and it's called applying expert knowledge. So as we mentioned previously, we use the raw data. Our machine learning model builds the causal structure based on what data tells us. So we tell the truth from the data. But a human expert can still collaborate with the machine by teaching the machine. In this case, we know all of the behavioral variables drives Q-chat 10 score. So as a human expert, I'm going to set all of the behavioral variables to drive Q-chat 10 score. So I'll unselect non-behavioral variables. And my end node is Q-chat 10 score. I'll add and relearn. Here's the new graph. So now we see all of the variables are driving Q-chat 10 score. Another one, if you remember from the original graph, Q-chat 10 score, the higher the score, then the more likely the toddler has ASD traits. So we can potentially add another expert knowledge, but here we have a few more minutes left. I will speed up with my demo. Now in this case, let's take a look at key driver analysis. So our target is Q-chat 10 score. We'll view the key driver by total causal effect. And how to interpret this graph? There are many red lines. Red lines are okay. They mean negative causal impact. The blue lines means positive causal impact. So the first one, use simple gestures. If a toddler does not use simple gestures, then the Q-chat 10 score is higher, which means the toddler might have ASD traits. Similarly, if a toddler does not follow where I'm looking, then the Q-chat 10 score is higher. That means the toddler might have ASD trait. So this is in fact a great example of human and machine intellectual collaboration. So our machine model tells the truth from data, but sometimes we do need expert knowledge to make sure the data tells the truth. So we are as good as what the data tell us. So those are the examples. So those examples, I hope, gave everybody a taste on how we can apply causal analysis to healthcare and pharma.